is Woody Collins with Congo Helping Hand, and we are here to talk about the Congo. This is a dreary Monday here where I'm at here in Indiana, and so I'm sitting inside. And the background that you see is actually the Kananga from the water tower that's in Kananga. Yes, Kananga has a water tower, and you can climb up in there. Occasionally, they pump water up in there, and whenever they run the water, and it provides water uh, to, I don't know whether it provides even water to parts of the town, but it should. And people also come over and get water from the top of it. So one day we climbed up into the top of the water tower to see what was going on. But that's not what we're going to talk about today. Maybe some another day we'll talk about the water tower. But today we're going to talk about health, the health zones and the health management of how Congo is run. And I thought it would be an interesting subject. For one, that we're going to have a conference on Saturday uh, with the Congo Mission Network, and it's going to be on the subject of health. And I thought for maybe some of the people who may want to, it's free and it's going to be online. And so for some of those who may want to check the conference out and come and visit, it is at, like I say, it's at 11 o'clock on Saturday, and you can register. I'll be posting stuff to let you see how to register for it, and then you can attend. Should be pretty good because one of the subjects they're going to talk about is how COVID has affected Congo compared to the United States. And I think I've given you a hint of something that is going to be very interesting. So I want you to maybe take advantage of it. Okay, but we're going to talk about health zones and health zones. Let's see here. Let's. Oh, sorry, Lou. Oh, thank you. Oh, oh, gee, I got to get the sound. Where is my sound? I tested this out beforehand, and it worked okay. Oh, no, 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 no. Okay. Hope you have sound now. Lou, are you getting any sound now? Let's see. I could test it real fast. Testing one, two, three, four. Nope. Testing. Okay, there we go. Okay, so I think I got sound now, and we will go on from here. I tell you, it's strange. Uh, Sometimes you have those difficulties. Okay, let's talk about health zone. Congo is divided into provinces, which is the governmental uh, equivalent of states and things, but they are also divided into health zones, and the health zones do not relate. There'll be multiple health zones within a province, but they pretty much contain within there because there's a within the province there is a health minister who kind of looks at the health zones and everything like that. Uh, so thank you, Lou. I'm glad you were on today because I don't know, I had sound earlier, but it just disappeared. So thank you for checking on and let me know that. But the health zones are uh, there's 516 of them, where there's only 28, uh, 26 or 28 provinces. So what I want to kind of give you an idea of it, because a lot of the talking when we talk about health in the Congo, we talk about health zones. When we say there's a Ebola outbreak, we say in so and so province and how many health zones it is. Like the current Ebola outbreak now up in northwest Congo is in 12 health zones. And so what I want to do is I can hopefully bring up a picture of a health zone and we can show you what they look like. And that should be appearing. This is really, really, really funky today. Okay, so I was hoping that these health zones would be showing up, but don't look like they're appearing. But so we have like 26 different health zones, and when we talk about, you know, any type of outbreak, any type of disease, how things are going, we refer to those health zones. So it can kind of be uh, like a county. So within, let's say, the state, you have your counties, and so you would say, oh, there's an outbreak in Pennsylvania, and it's in so many counties within there. So the same thing as we talk about the health zone. However, those health zones, what make it so unique about Congo is those health zones are not actively supported by the government. And also, their theory is that they're going to have one health zone one general hospital per health zone. But with 512, there's probably surely not 512 hospitals there, because I know in the Kasai where I'm working at, there is not that many hospitals, and we got 26 health zones, but there's not that many hospitals. So you will have something, maybe a reference clinic, which is maybe a larger clinic that would be responsible for trying to supervise, maybe have the best equipment, that they would be put those into the health zone. Uh, some of the health zones do have hospitals, like in Bulape, which is it's a health zone, and they have a hospital there that was started by the Presbyterians. Uh, and the Presbyterians have 8 different hospitals that's located in that area. And each one of them is a reference hospital that makes up part of the whole total area. Now, there's other um, denominations that have hospitals there, the Mennonites in our area, and also the Catholic. And then there are a few government hospitals. So, so it's a management of hodgepodge of different non-government organizations, which is primarily churches, and the government will have so many hospitals. But as we all know, that the hospitals being are not enough for Congo. So the government doesn't have enough, and then pretty much the missionary hospitals and stuff, they try to do what they can to make up that shortage of hospitals. So that's kind of the management of it. when you have a hospital that's managed by, uh, let's say, in our case, the Presbyterian Church, we in the United States, we try to support those Presbyterian churches with equipment, people. We sent over missionaries to work at the hospitals, who are doctors, administrators, a thing. We've had a number of different doctors at each one of the hospitals. And back in the early days, it was totally managed by the Americans, but now it's managed by the Congolese. And so they try to have at least one doctor in each one of the um, uh, for each hospital, and also maybe a doctor for the health zone. So they work together. So if someone is sick out at one of the clinics within the health zone, they will refer them back to the hospital to have whatever surgery they need or whatever the case may be. And in some cases, those clinics are a great distance without roads, uh, any type of transportation means to get to the hospital. I remember we've been driving down the road near the hospital, uh, maybe 20 or 30 miles away, and there will be somebody on a bicycle bringing somebody to the hospital for care. Sometime that person has actually died, and they are, they didn't make it to the hospital because they maybe waited a little too long or something like that. So, that's kind of the management of it. And so what I was saying earlier that you may probably didn't hear, on this Saturday at 11 o'clock Eastern Time, the Presbyterian is going to have a mission network where we're going to have some doctors and Americans that work over in the Congo with the Presbyterian hospitals and the medical system. They're going to be online uh, doing a presentation about what's going on in the Congo with the COVID, with also different elements of what's going on there. So that's the reason why I'm primarily was thinking uh, to try to maybe give people an understanding of what we talk about when we talk about health zones and how clinics are set up and how, that whole system is set up. So, sorry that the sound went out on you earlier, but I just want to give you a kind of information about that. And maybe the reason why I switched uh, programs today, I decided to come inside. So I'm sitting inside, which is a lot different than outside, where I'm kind of unfamiliar with it, but I need to learn both ways of doing these broadcasts, both in-house and actually outside. Because and I got a green screen behind me, and that's what I was saying. That was a picture of Kananga from the top of the water tower that's located in Kananga. Uh, so that's why I'm here today, and that's why you see the scenery a little backed up and everything. But I'd like to thank everybody for coming on, and we will talk about health and try to interest you in the signing up for a free talk. Probably will last about an hour to 2 hours. That's on Saturday at 11 o'clock Eastern, and you can get an idea of, in general, what's going on in Congo from a COVID pandemic perspective. That's one of the talks that's going to be on that. And also, they're going to have other topics that will be of a general nature about information on the health care system and stuff like that. So, this was just a preview. Thank you all for stopping by, and thank you, Lou, for letting me know that I didn't have any sound. And like I've said before, the reason I'm doing this so that I can be prepared to do this when I get back to the Congo later this year. So take care, everybody, and be blessed. And we will see you later. We're, we're good for the day.
Take care now.